Welcome back into Great Day, Washington. This segment is sponsored by University of Maryland Capital Region Health. The D.C. area is a transient region, but many people end up making it their home. And a key part of making a place your home is establishing a regular relationship with a primary care physician. Here to tell us about the upside of having a primary care physician is Dr. Tony Aluko-Anaforum, a family and sports medicine physician at University of Maryland Capital Region Health. Thank you so much for being here today.
Thank you so much for having me. Such an honor to be here.
Yes. Well, tell us exactly, what does primary care mean and what are the benefits of establishing that relationship?
Absolutely. Primary care is really the foundation of the healthcare system. So with primary care, we focus on preventive health, but we also focus on managing chronic and acute medical conditions. So when we think of preventive health, we think of cancer screenings, we think of vaccines, and the benefits of having a primary care provider, physician, nurse practitioner, physician assistant is that you get to partner in your health with someone who really gets to know you well. And the key is really having a longitudinal relationship, someone who gets to see you really throughout the different stages of your life.
Right. They've seen your baseline and they know where you have grown, and it's so important to partner with your physician.
Yes.
Now, are there different kinds of primary care physicians?
Yes, there are. So when we think about primary care providers, they can be medical doctors, so physicians who went to medical school. We can also have nurse practitioners, physician assistants as well. And they can practice in different fields. So we have the field of pediatrics, which focuses on newborns up to adolescents, sometimes even up to age 21 if there are special needs. We have the field of family medicine. That's really care across the lifespan. We kind of think about it as cradle to grave, so taking care of newborns all the way up to our older patients. We also have obstetrics and gynecology, so these clinicians provide care for women's reproductive health care needs across the lifespan. We also have internal medicine. Internal medicine focuses on adult medicine. And lastly, we have geriatrics. So for our geriatric patients, they may be 65 and older and be under the care of a geriatrician.
Yeah. And you mentioned the regular checkups, the immunizations. Can the primary care physician also help with those long-term conditions like diabetes?
Absolutely.
Yeah.
And that's the beauty of primary care. We really can address a range of conditions. So both the acute conditions, so if somebody's feeling sick, but also conditions like high blood pressure, diabetes, any other mental health concerns that a patient may have. We're well equipped to take care of it and also connect the patients to specialists if that's needed.
Okay. Now, what's your approach to caring for a patient?
Absolutely. I approach care for my patients as listening first, talking second. Because what I really believe is that each patient has a story. Each patient has a background when they come in to see me. Sometimes in the hustle and bustle of clinic, it's easy to set my own agenda first and not realize that the patient is coming in for something else. And I remember having a patient who I hadn't seen in a couple years. I'd actually never met the patient, but they hadn't been seen in our clinic for a couple of years. It's easy to judge and say, well, maybe they just don't care about their health. But upon talking to them, I learned that they had actually been incarcerated. So they hadn't been able to connect to the healthcare system. Had I made a snap judgment, that might have really disrupted the patient-physician relationship. But being able to learn that from them helped us to come up with a good plan to get them back on track in terms of their health.
Yeah. Well, that's so nice to hear that you listen first and then you're treating after. How easy is it to schedule an appointment?
It's relatively easy, very straightforward. We have a few locations throughout the PG area. So we have locations in Laurel, Largo, New Carrollton, National Harbor, as well as Suitland. Patients can call our number to schedule 240-677-3000. And usually appointments are available within 2 days or so. They can also visit umcapitalregion.org/primary care. And there's also ways that they can learn about the services we offer, as well as other clinicians that are available.
Yeah, to get an appointment in a couple days is phenomenal.
Absolutely.
Thank you so much for being here.
Thank you so much for having me.
Yes. Once again, you can go ahead and schedule an appointment with a primary care physician by calling 240-677-3000. Again, that's 240-677-3000, or go to umcapitalregion.org/primary care.